Hello.
Hello.
So I just have a couple discharge instructions I'm going to go over with you before I bring Bella in for you to take home, okay?
Great.
So she is awake. She's been awake from her anesthesia. She will be a little bit drowsy for the rest of the night, so the best thing to do when you get home is if you have a quiet area where you can kind of keep her for the night, if she has a bed or even a crate where she can just kind of rest for the rest of the night until the anesthesia is out of her system. That's kind of the best scenario. Tomorrow she should be back to her normal self. As far as feeding instructions, it's okay to feed her tonight. I would feed her probably half of what you normally feed her. I wouldn't give any treats or any different type of food. Stick with whatever her regular diet is. Sometimes they can still be a little nauseous from the anesthesia in their system, so if she doesn't eat tonight, that's okay. But if she's not eating by tomorrow afternoon, then you're going to want to give us a call.
Okay.
Things that you should kind of look out for, if you notice her vomiting, having diarrhea, or extreme lethargy, that's something that you'll want to give us a call, or if it's after hours, you may need to take her to the emergency room. Like I said, she's a little bit drowsy, but she is up and moving, so if she's like completely laid and just not wanting to get up or move at all, I would say that's extreme lethargy, and you should probably give us a call if she's acting like that, okay?
Okay.
You may notice a small amount of blood coming out of, like in her saliva. She did have 8 extractions today, so that's normal. If you do notice a large amount of blood, though, there may be something wrong with one of her sutures, so you'll want to give us a call for that. The sutures that are in her mouth are dissolvable, so they will dissolve in a few weeks. We do offer a free dental recheck in 1 week from today, where you'll just bring her in and the doctor will just check in her mouth and make sure everything's healing properly.
All right, great.
She is going to go home with a few medications, so I'm just going to go over these with you really quick. She's getting Rimadyl. This is a non-steroidal anti-inflammatory. We actually gave her an injection of this at the hospital to kind of keep her comfortable after the procedure. So you can go ahead and start this one tomorrow because she's already got that one in her system.
Okay.
The other one she's getting is Tramadol. Tramadol is a pain medication. This one can make her a little bit drowsy, a little bit sedated. That's normal. If it's extreme, like I said before, that's something you want to give us a call. We may need to adjust her dose. And the last thing she's going to get is clindamycin. This is an antibiotic. We're just giving this just to make sure that she doesn't get any type of infection in her mouth where the extractions were. Do you have any questions on the medications?
Nope.
Okay. I would give them with food if possible. Sometimes they can get a little bit of an upset stomach, especially if given on an empty stomach. But usually if you give them with food, they're okay. If she does vomit or have diarrhea or anything like that from the medications, give us a call. We may need to switch the medication or adjust her dose.
Okay, great.
And then this is for you to take home. This is just written instructions. It's pretty much everything I went over, but you can kind of read over it and remind yourself. And if you do have any questions about anything, give us a call.
Okay.
All right?
Super.
All right, I'll go
Thank
grab her
you.
for you. You're
Okay,
welcome.
great.